So if somebody's got a lot of wear and tear in the neck, most of them will present with neck ache, neck pain, which often refers over your shoulders, up behind the head, over the head, a little bit round the side of the head, down between the shoulders. And the big muscles on the back of your neck go into spasm and it's very sore. And often there are trigger points and tender points, and that's really pretty common. It's not something to get alarmed about because most of the time it comes and goes and certain activities make it worse, and most patients learn what does cause trouble and what seems to help. And the wisest thing with this is to probably seek help from a physiotherapist if it's getting bad, or osteopath or chiropractor or some therapist who's sort of hands-on, perhaps help with some of the muscle spasm and give you advice on posture and exercises, etc., losing weight, etc. Don't forget your arms are heavy if you're very overweight and they're pulling on your neck. And also avoid lifting and things, because the more you're pulling on these neck muscles, the more you're pulling on the spinal column in your neck, because your head is supported by your neck vertebrae, but also all these big muscles are hanging, if you like, off the back of your skull. So when I lift something heavy, my shoulders are being pulled down, but my shoulders aren't fixed to my spine at this level. They're all hanging off your trapezius muscles and all these big muscles going into the back of your head. And these are huge muscles. So if you keep those in good order and look after them, it may help. So exercise, there are all sorts of things that therapists can do, and they'll often work on tender areas of deep massage, acupuncture, all these things. It's horses for courses. The next thing is medications. Keep it simple. Anti-inflammatory if you're safe with your tummy, no bowel troubles, no risk of hemorrhage. If you're anticoagulants, of course, you can't have these things. But ideally, keep to something like ibuprofen, or simple drugs, and your family doctors or pharmacists will have them in the pharmacy. You can get some of these, and paracetamol. And those simple drugs may be good, and it's always good to take them if you know you're in for trouble. It's going to give me trouble, my neck, because I'm going to have to do this activity. I've really got to do it. I don't want to do it, but I've got to do it. Maybe take them before, because if you take them prophylactically, you often find you don't need as much. Once you start feeling the pain ache, you sort of need more to try and get rid of it, because your brain is tuned now to feeling it. But I strongly advise many patients try and keep off the strong medications. There's been a catastrophic disaster in the Western world, particularly triggered in the United States practice, I think, where people have been given very strong analgesics, but unfortunately these drugs can lead to physical dependence. And they're dangerous drugs. And what often happens is people get put on more and more tablets, and the pain doesn't go, because actually the tablets weren't going to help very much for this sort of pain. So the pain doesn't improve very much, so they increase the dose. Then they'll add in another one and another one. And while this is all going on, unfortunately, the patient is gradually becoming addicted to the requirement for the drugs. Psychologically addicted, but then physically dependent. And this is very dangerous. So that is a bad pathway to go down unless it's very carefully supervised and for brief, severe periods of pain, not as a maintenance. The next step is to consider investigation and looking into why you might have neck pain if it's getting bad. And I've no second thoughts about it, although there's much criticism, there are all sorts of paradigms why you should have an MRI. But at the end of the day, if you've never had a scan of your neck, often an MRI, I think, is the most useful investigation. Many people say, oh, it'll throw up all sorts of abnormal things that are incidental. Well, it's up to the clinician who's ordered the MRI, who's going to go through it with you, to explain that and put those in perspective. It's sometimes better to know that thing is there than not know at all. So if you're terrified of it might turn up something slightly odd that won't need treatment, well, don't have it. But the MRI gives you a chance to really open the bonnet and see what the spine is like, because it shows us not only the structure of the vertebrae pretty well, although MRI is not as good as the X-ray modalities like CT for looking at bone detail, but it's so good because it shows the spinal cord and the nerve roots and the soft tissues. So I think MRI is a fantastic, revolutionary investigation. It's transformed spinal care in my career dramatically. And it's safe for the vast majority unless there are reasons you can't have it. And those might be a pacemaker or you're extremely claustrophobic, etc.